I'm excited to share a presentation of the new DRS system with you. This new system will allow you to do everything that you could in the old system, but I find it much more user-friendly. Some of you have used the old system, and for our newer vendors, this will all be new to you. So let's take a look. These are the topics we'll be covering in this presentation. There'll be general instructions and a review of the new insurance summary screen. Why is DRS changing? Well, NHRS is upgrading its pension administration database known as Pension Gold. The Employer Data Reporting System, or DRS, is a component of PG. The current version of DRS, or version 2, has been in operation since the early 2000s, which is a long time for a piece of software. It simply was time to upgrade to a more modern version of the Pension Gold software, or version 3. Here is a timeline of the Pension Gold and DRS upgrade process. Upgrade development and testing of the system began in January 2019 and is running through December of 2023. Training is happening now, and the systems will go live December 1st, 2023. The new DRS will be more intuitive and give carriers and employers more control. Key changes are as follows: ability to report retiree and dependent deaths easily through DRS, ability to add, update, and terminate coverages with more intuitive screens, ability to see what pending items may require more information or documentation in a DRS queue rather than through separate emails, ability to see the current payment information in real time. To get started in the new DRS system, existing users will be able to use their sign-on credentials to set up an account in the new DRS. It's a fairly straightforward process, and we've provided some written instruction for that in a PDF with your invitation. All new users will need to set up an account in the new DRS, and that was also provided in your invitation in a PDF. There are a few steps to follow to get everyone set up. Employers will submit a form requesting access for each authorized user, just like they do now. That form, I believe, was also provided. Once the form is processed, NHRS will email the individual user a link to set up their account, along with a unique access code. This link is good for only 48 hours. These are some of the terminology used in the new DRS system. Some will look familiar to you from the old system, and we do have a few new terms. There is a glossary of terms provided in the PDF in your invite as well. And this is what the login screen will look like. Once logged into DRS, employers will see this dashboard, which is a new feature in PGV3 that gives employers a quick view of some key items. We'll go into greater detail in the next few slides on the navigation menu on the left and how carrier communications work. As for the other sections of this page, under authorizations, clicking the plus sign or add button opens a new insurance reporting screen where you can enter a new insurance deduction record for a user. We'll cover this process in greater detail later in this presentation. Carrier account shows the current payroll information between NHRS and the specific carrier logged in. Associations are the representatives and employees of the specific carrier that is logged in. So, broken down by section, here's that menu from the left side of the previous slide. Carrier account is where the user can change, terminate, reactivate, or add new premium rates for each coverage type offered. Insurance reporting is where a user can add, modify, or terminate coverage at the individual level. Reports are where a user can run a benefit payroll insurance deduction register or an insurance active rate report. And finally, there are links for contacting NHRS and a link for the help section for DRS FAQs and instructions. The carrier communication section will show what is currently being worked on by our NHRS staff and the status. This will show when NHRS needs more information, for example, documentation, or if an item has been denied by NHRS. The filter will allow you to see older communications, as this screen will only show the most recent. Coverages are what we previously referred to as rates. This screen allows the user to view, edit, terminate the rate, and the little add button will be used to enter a brand new rate. Mm. For carriers with several coverages, this screen will only show the top 50. To view more, there is a filter option. Clicking on the filter option will give the user fields to narrow down the information to find specific coverages. This screen gives you the option to clear the filtering or apply it to move on to the next screen. This screen is showing a specific coverage that was filtered for. The user can see the information specific to this coverage. Coverage can be termed on this screen, and one thing to note is when terminating a coverage, a reason is required. Replacement coverage is what we currently refer to as a mass move. This is the screen to be used to select a specific coverage or collection ID that the user wants to replace. A replacement coverage can be selected and applied to either all associated payees or to specific individual payees based on if they are checked in the box to the left of their name or not. This will term the current coverage and replace it with the new one for the selected associated payees. More details are on the next two slides as to what happens when Update is clicked. Once Update is clicked on the previous screen, the following validations are performed by the DRS system. This is a list of possible errors and warnings. For example, not entering the last day of the month as the term date, or if the collection ID is selected without a corresponding coverage. When there are no errors, the system will complete these actions. If a replacement coverage is not selected, for all associated payees, the insurance deductions for the terminated coverage are terminated as of the given termination date. The coverage is terminated as of that provided termination date. If a replacement is selected, for all selected associated payees, the insurance deductions for the current coverage are terminated as of the given termination date. New coverage records for the replacement coverage are created for the associated payees effective as of the first of the month following the termination date. Payee coverage updates are processed through the authorization review process, and that's what NHRS handles. If all payees are selected, then the coverage is terminated as of the provided termination date for all. If not replacing, but rather editing or adding a coverage, this screen will come up. Please note that all fields are required. Once add or update are clicked, the DRS system will check for the following validations and errors. For example, if there is an issue with the effective date or if there's an overlap in coverages. The new DRS is a search by Social Security number or SSN system, just like the old DRS was. Clicking Find will either bring you to a single payee or it will list the benefits associated with that SSN as pictured here. These validations are performed by the system once an SSN is entered. This may be good information to refer back to if you're having an issue with an SSN search. And we did provide a copy of this presentation in PDF format as well. When the exact match is found, the payee insurance screen will display. The payee information section displays all the basic payee demographic information, as well as their Medicare number and eligibility dates. If Medicare information does not exist, then those fields are blank. The next slide shows some detail from the insurance section in the middle of this screen. The insurance section of the payee insurance screen displays the coverages, dependents, and Medicare information records for the payee and those dependents. The coverage, dependents, and Medicare information are displayed in a tab format as shown here. Each tab displays the current posted information. The pending approval indicator is displayed if the record has a pending authorization associated to it. The pending approval indicator would appear just after the last column in this grid. And we do have an example of this coming up in a few slides. If the user clicks on the terminate link next to these coverages, the system brings you to the next screen. This is the insurance reporting screen where coverages and deductions can be terminated. A termination date reason may be entered, and clicking Update will save the information to be approved by NHRS staff. If the reason selected is coverage change, more fields appear where replacement coverage can be selected. From the drop-down, and clicking Update will update this information as well. If a retro is required, a retro date can be entered. Reminder that retro date requests are only for NHRS medical subsidy. Going back to the first screen upon a user logging into DRS, we will look at this reporting coverage button. Upon clicking this button, the following screen will appear. The insurance reporting screen is where the individual, example a payee or spouse, may be selected as well as the insurance type and coverage information. An effective date is required. A retro date is available if an NHRS medical subsidy retro is needed. The medical subsidy only box is also available should that situation apply to the individual selected, just as in the current DRS. Going back to the insurance screen for a specific payee, there is a tab next to their coverages for their dependents. Here, a dependent can be edited or terminated by clicking those links, or a new dependent can be added by clicking on the Add button. As with other tabs, the pending approval indicator will display for any authorization on the insurance screen for any still pending NHRS staff approval. As mentioned, dependents can be edited by clicking the Edit button. Also, a dependent may be terminated by clicking the Terminate button. When editing or terminating a dependent from the grid, this screen appears. When terminating a dependent, a termination date and reason are both required. If the termination reason is death, the date of death and death type fields are enabled. Upon clicking Add, the dependent record is updated. If a termination reason of deceased is selected, then the status of the dependent is updated to deceased. If any other reason is selected, the dependent status is updated to inactive. The last tab under the insurance information for a specific payee is where Medicare information may be edited or added for the payee, that's the retiree, or their dependent, for example, their spouse. As with other tabs, a pending approval indicator will show when the information is pending NHRS staff approval. Medicare information is edited by the user clicking Edit beside the person's name. New Medicare records are added by clicking the Add button below the grid. If clicking Edit or Add next to the Medicare information, this screen appears. This displays the name of the individual selected, their Medicare number, and their dates for Part A and Part B eligibility. These fields can be typed into, and clicking Update will save the information for NHRS staff to approve. Going back to the first screen or the summary screen and clicking on queued items will bring the user to all items pending NHRS staff approval. You will see the status pending in the highlighted column and the links to view, edit, delete, or provide documentation for the line item in that queue. Once documentation is clicked, the screen for attaching documentation appears. Documents are uploaded by clicking the Attach button and then navigating to the document saved to your computer. Examples of documentation would include a Medicare card or a deduction authorization form. Once the document is uploaded, the Attach button becomes Delete. Clicking Save saves the uploaded documentation to that authorization. The Delete button is used to remove an incorrect attachment. If all required documents have been uploaded, the current status of the authorization was documentation required, Then the status of the authorization is updated to pending. This again puts the approval in the hands of NHRS staff. Resources for employers and carriers are listed here. For your insurance related questions, DRS support, and some resources for employers. And this was also included in the PDF to your invitation. And this concludes the DRS carrier training presentation.